Hi, I am talking to Mark right now about his experience with the Fotana anti-snoring laser. Mark, how are you?
I am wonderful.
Good. Can you tell us a little bit about why you chose the anti-snoring laser and your experience with it?
I really didn't have a choice. My wife told me that I had to do something or move away from home. This felt like a good opportunity to address an issue that I've had, which is terrible. I snore very loudly and most of the night and don't sleep very well at all.
Very good. Okay. Now, what was your experience like? Like you came into the room and tell us about your experience with the laser and your experience with the procedure.
Surprisingly, no issue whatsoever. You sit on the table for just a few minutes. Dr. Pintel worked with me, explained exactly how the procedure was supposed to start. No problems whatsoever, not even a scratchy throat the next day.
So they didn't really have to give you any pain medication or any?
Absolutely nothing.
Oh,
absolutely nothing. I got a result the first session, got a better result the second session, and I'm here for my third.
Okay, great. And what do you expect after your third session?
Well, I'm probably 75% better than I was, and we're looking to get over 80% now. And just like I say, it makes for a lot better sleep. It hasn't made me any prettier, but it's sure made a big difference in how I sleep at night.
Okay. Now, would you recommend this to a friend?
I would tell you that if you don't do this, you're missing out. This is a real change and has made a real difference for me.
Great. Thank you. What we are looking now is a drawing of the oropharynx area or the oral cavity in a patient's mouth. This is type 1, 2, 3, and 4. If you have type 1 or 2, you have more likely chance of having a good response to the anti-snoring laser treatment. Now you will also have a good response if you are a non-smoker and if you have a good BMI, which is body mass index. The next drawing shows us inside the oral cavity, and this is the tissue, and these are the areas that the lasers treat, and it helps tighten the soft tissue area. Then that will then open up the airway passage to help decrease vibration and decrease snoring.
Well, it's over with. Wasn't nothing to it. Look forward to the result.
Awesome. And how do you feel?
Feel great.
Awesome. All right.